Okay, good afternoon, everyone. My name is Nicole Sirotin. I'm an internal medicine physician and lifestyle medicine physician. And we will be talking about lifestyle. So, I'd like to start off with thinking about what do I mean by lifestyle. So we all wake up, we eat, we move, we sleep, we stress, we love, and this makes up our life, right? And so what is lifestyle medicine? We've been practicing lifestyle medicine since before we had a name. We've been practicing healthy longevity before we had a name for it. And when we think about this, this is 70% of our health, right? One of the most impressive speeches I heard from Martin Luther King was not to a large audience on the national lawn, but he actually addressed a junior high school, Barrett's Junior High School, and was talking to these young kids about their future. So this famous speech happened in 1967. This was in the middle of the human rights crisis in the United States, 6 months before he was assassinated. And he looked at these kids and he said, this is the time that you're building your house, right? And what is your blueprint, right? He asked these kids, what is it that's in your blueprint that's going to help you be a successful, self-respecting citizen of this great country, right? And what I love about this story is that that theme is part and parcel of how I practice, right? And how we approach humans on helping them think about what are the choices that they make and how does that help them move toward a healthy longevity path or not. And so I want to shift us a little bit back into the human factor here, because at the end of the day, our goal is that humans live longer, right? This is what we're talking about, but not just longer, better, healthier, with more vigor. And I am extremely excited about the technologies that are coming and how we'll be able to have better diagnostics and be able to show people in a more clear way where they are on the map of their health. But at the end of the day, right now, this moment, where we have the most evidence in lifestyle, in longevity is in lifestyle, right? And so I feel strongly that we should all be talking this talk. We should be walking this walk. And as we move forward with again, these advances in science, this really is the place that should not be forgotten. So we sit here, right? This is us. We have our genes. Genes are, of course, very important, not the whole story. We have our microbiome. We have our family history. We have what we were exposed to. And then we have this path. And we either choose it or it's chosen for us. And so everyone is aware of the blue zones. I think this is now extremely popular, which is great. People are sending me the series, asking me if I've seen it. And of course, this is excellent real world data, right? These are people who live a long time and we should learn from them. Now, what strikes me about the blue zone data is that these people are from different parts of the world. They have different diets. There are themes, 100%. They move. They don't eat. They don't overeat, let's say. Plant slant is a nice way to put it. They eat a lot of plants. But what really strikes me about this is actually purpose, belonging, loving, downshift, right tribe, and how central that is to their longevity. And this is not something that actually we focus on a lot in medicine or in science, right? This is actually, I think, part of the neglected side of longevity. But how important it is that we remind people that we need to gather, we need to commune, we need to have that love in our life. And this is still science, right? This is still important data. So I'm going to briefly go through some important studies in lifestyle and in longevity. It's not an extensive list. There are over 2,200 studies associating lifestyle with longevity. So I will just highlight a few of them. So dietary restriction is one that I think we're all probably well aware of. So looking at different types of fasting has been studied in almost every single organism that can be studied. So the real question is, what do we see in humans? And the cellular mechanisms of fasting are well known. We have improvements in insulin resistance. There are IGF-1. We have many markers in our brain that look at health. And I think when we're thinking about the brain and we're thinking about both energy restriction and exercise, there are these shared mechanisms. And this is true with almost every lifestyle intervention. We have there's a shared mechanism at the root of the impact. And so when you look at cognition and brain health and dietary interventions, really this corner here is the aging corner, right? So the most important out of calorie restriction, intermittent fasting, polyphenols, and of course the polyunsaturated fatty acids, right? You can really see here that the polyphenols and the polyunsaturated fatty acids have the most data. Now, of course, the calorie trial was very important. This is again, randomized controlled trial, our highest level of evidence, asking people to eat less food. So we all know that this is extremely challenging, and one of the main drawbacks of this study is that they wanted 25% calorie reduction, and they got 11.9. But 11.9% reduction had significant improvements in biomarkers that are important for cardiovascular disease and aging, and they were able to maintain their muscle mass. So one of the challenges that we're facing right now in medicine, as many people are aware, there are these new drugs out, new pharmaceuticals, that help people lose weight, and people are losing a lot of weight with them. Unfortunately, they're losing a lot of muscle. And so part of the challenge here is that what looks like a great solution to one of our biggest problems, we're seeing on the medical side that actually this is something that is significantly impacting one of the most important parts of longevity, which is maintaining your muscle mass. So there's also a study looking at switching your diet from let's just call it a poor diet, to one that is rich in fiber and whole grains and nuts. And you can see here increases in life expectancy modeled out. This was a nice study out of Norway for both men and women. The important thing in this study, in my mind, is that you're getting a lot of benefit if you do this when you're 60. You're also getting benefit if you do it when you're 20. So yes, should we have had our blueprint right from the beginning? Should we have been, in junior high school eating our legumes and our nuts? Maybe. But the second best day to start change is today, right? So this is another great study showing the impact here. Gut microbiome, one of my favorite topics. Many studies showing the influence on aging, including immune response, anti-inflammatory. I'm going to leave this topic for more discussion. But how do we do that? Fiber, probiotics, prebiotics, exercise. So the exercise impact on the gut microbiota, I think, is also a very interesting area of research that's developing. Okay, let's talk about exercise. So again, we all know we should be exercising, right? How many of us are exercising regularly in the amount that we want, in the amount that studies show? This is something that, again, going back to the Blue Zone data, is much more important when we think about movement in general. How many of us have sat in that chair for 6 hours today, right? So thinking about how it is that we're able to live this life that contributes to our longevity. Now, there are many links between exercise and aging and epigenetic regulation. We have clear evidence that this is happening on a cellular level and modification of DNA and methylation. We have many we have many studies showing the impact on pretty much every organ and every tissue in our body in a positive way. So there was an interesting study that came out in 2020 really looking at resistance training. And I think that this is one of the most important studies recently most important reviews that has come out looking at exercise and really showing, okay, we have a 21% lower risk of all-cause mortality. This is compared to no exercise, though, right? But 40% when you combine resistance training with aerobic exercise. There was another study that was very interesting looking at Swedish women. It was a cohort over 44 years of Swedish women and how they compared actually women in middle age and how much exercise they did and then dementia risk. And what was fascinating about this study to me is that they compared the vigorous exercisers to the moderate exercisers. So here, okay, compared to no exercise, it's going to be pretty obvious, right? People will do better. But in that study, there was actually a 90% reduction in dementia risk in the vigorous exercisers as compared to the moderate exercisers, right? So you're talking about even if you're exercising a little bit, right, that you're going to get up to 90% more benefit if you go into a vigorous exercise plan. So another interesting look to see how can we improve, how can we optimize our patients, our friends, our families' lives from the data. I want to just very briefly touch on this study. I know this was a popular study that came out recently in Aging Cell, looking at the DAMA study, which is, again, another randomized trial looking at both diet and physical activity intervention, and then an aging clock. And the positives that came out of the study is they showed that this diet and physical activity intervention improved the aging clock parameters, but I challenge us all to go a little bit farther, that this is not enough. We need to actually show that people's lives and health are improved, right? So yes, it's helpful, and absolutely we need to pull in novel diagnostics to be able to measure this, but especially with the aging clocks, my hope is that we connect that with real clinical outcomes. We can say with certainty that what we're doing is helping someone live longer and healthier. Sleep, I will breeze through because I think this is, while one of our most challenging problems here in the UAE and one of the most important aspects of health, something that the data are pretty uncontroversial. The sleep issues, I think, around the world are impressive, but I will tell you just one story. I was laying in bed reading a book, and I got a call from one of my patients, and it was 9:30 p.m., and he said, "Good afternoon, Dr. Nicole, how are you?" And I looked at my watch, and I said, "Good evening, how are you doing?" So there is a real question around sleep in this region that I think we need to dive into on the research side. So sleep and longevity, it's really clear. You need sleep. We all need sleep. This is pretty universal. Stress, I think, is, again, something that we haven't studied enough. And how do we get to the point of being able to look at it from a longevity perspective? This was an interesting study looking at 400 healthy adults and their epigenetic clocks after controlling for known factors, looking at the impact of stress. So I think that these studies are important. Again, I implore us all to do more research on this, especially when we look at the Blue Zone data and our real-world data and the effects that social connection has. So I'm going to pass the microphone off, and we will hear from Rudi on more real-world data.
Thank you. Hey, Nicole. So hi there. I'm the sidekick. Let's continue. It's okay. Let me introduce you or connect you with real-world data. means the data that you produce, and maybe I need some orientation whom I'm talking about to. Who had lunch today? Of you, raise your hands, please. So you produced real-world data. Unfortunately, we didn't capture it, which might be a problem if you want to run a longevity AI. And now I don't know what you had for lunch, or for some people I know. And if you want to connect a longevity AI with real-world data, there are other real-world data classes, like, for example, your phenotype, nutrition I mentioned, your lab values. I'm sure you had no lab test after the lunch. I will ask you later something else about this. So you see, there are many real-world data classes, and obviously it is difficult to capture all this data in the granularity. A data scientist would come up and say, oh yeah, I want to have it all. Now, so to be fair, that AI, that crystal ball that delivers insights, there is a little bit a problem with there is no consensus how to run that whole thing. And aging is very complex, means you have this many variables. And that's, on the other hand, that's why people hope for machine learning, because it's simply too much for the tiny human being. And it depends on the quality of the data. And here we are again. I don't know what you had for lunch. And this means I have a little bit of quality problem. I need your book, whatever, your records, not available. And because of that, you have sometimes a problem if you want to train an AI. On the other hand, the AI in machine learning is our hope to get rid of this complexity. So that is a little bit contradictory. Nevertheless, there is plenty of research, and you may have some insights that are, well, I say, not new, but a little bit surprising. So first of all is, I don't ask you now who had an infection, but obviously if you analyze real-world data from the clinic or the outpatient sector, you see there is a contribution of viral and bacterial infections to senescence, cellular senescence, and aging overall. And now the question is that good or bad? If I had an infection, is my immune system then strengthened or weakened in the long run? And you can have pretty much discussion about that. And that is one field where machine learning could contribute in the future to the current state of the knowledge. In general, you should know that cellular senescence is a double-edged sword. You don't want to get rid of it because it's helpful when it comes to fight cancer. On the other hand, it's related to age-related diseases. And targeting senescent cells is become a very new, attractive therapy form for targeting aging-related immune problems. But because of that high complexity, we're still puzzling on aging types. So now, what is good for whom? And it's a big, big puzzle. We don't know exactly how many pieces the puzzle has, and we still have to figure out what is the picture. But that is one insight that you can already use today, targeting that cellular senescence. And that comes from real-world data, from large real-world databases, from hard scientific evidence, but is not so widespread currently. And especially it comes from autoimmune diseases. So now I need, once again, your help. You had lunch. And may I ask, who brushed the teeth after lunch? I'm very lonely. But why did I brush my teeth? So there is a crosstalk between oral health, for example, oral microbiota, but also oral infections, and systemic inflammatory diseases. For example, autoimmune diseases, but also cardiovascular diseases or diabetes. And some oral diseases are linked up to almost 5,000 systemic diseases. That is huge, but the evidence from real-world data is overwhelming. So I guess you already have an idea why I brushed the teeth. But there is something else. It's also the microbiota and the skin microbiota and the crosstalk with systemic diseases and modeling all through this real-world data that was captured in various large cohorts. In the end, the very humble recommendation based on overwhelming real-world data science is brush your teeth and see your dentist or run some form of teledentistry if your dentist is too far away, if you're traveling too much. So this is my last slide. There are various blue zones, but also other regions try to figure out how they compare to blue zones. And here is a study published in January 2023 from the Basques. They went for various real-world data classes, not only lab blood tests and also other clinical features. And then they used machine learning to develop predictive models. And in this cohort, that is not in every blue zone, but here we have the ratio 2:1 when it comes to females and males living in a residence. We have to discuss the interpretation. We have other indices like hospitalization, respiratory drugs used, and fun fact, a very, very, I don't want to say humble, but surprising thing is they have seen the family doctor more often than the people who died earlier. So maybe this was their version of quantify yourself. I don't know, because by that time they had no variables, if we are talking about centenarians who have been 100 in the last year. So it sounds a little bit funny because one would expect if I'm sick, I visit the physician, but quite obviously they have been healthier in their lifetime. Nevertheless, they went more often to the physician. And they had, by the way, the better oral status when it comes to the decay. But this is something, of course, you don't want to sell as visionary insight in aging and longevity. But the ironic fact is these centenarians did so. And when it comes to the predictive power of this family doctor visits, that was among the most overwhelming variables. So I would say 2 takeaways: at least brush your teeth after each meal and visit your family doctor or your GP. That's it for today. Thank you.